Hello again, everyone. I'm Patrick Wade with the Champaign County Joint Information Center, another one of our video updates today to keep you informed. Today we're speaking with Dr. Bill Pierce, who's the Chief Medical Officer at Christie Clinic, and Dr. Ben Davis, who is the Associate Director for the Emergency Department at Carle. We wanted to talk today about things that are not COVID-19. Obviously, with COVID-19, that doesn't put an end to other medical issues that people are experiencing. So we wanted to hear from some doctors about when people should seek out help when they're dealing with something that's not COVID-19. So Dr. Pierce, I want to start with you. What kind of resources does Christie Clinic have, and what are you providing for people who still need medical help for things not related to COVID-19?
Lately, there's been a lot of discussion on when is it appropriate to come in and see your healthcare provider. Out of abundance of caution for patients, our community, our healthcare providers, we have instituted visitor restrictions, we've stopped elective surgical procedures, and we've delayed and postponed a lot of preventative care visits until after this COVID-19 crisis. But everything out there looks different these days. But we want you to know that we are still open and providing essential care right now. It looks different, but we're still providing that care. Telehealth services are available for patients by virtual appointments. Christie has been doing about 100 telephone visits and over 200 video visits every day. And if you feel that it might be helpful in seeing your provider, try a telehealth visit. You may have a non-threatening condition, a chronic illness or a minor illness that may work very well through the telehealth services. So to schedule a telehealth visit, if you feel it's an option, contact your provider through your patient portal or by calling the office. Now, we're also seeing patients out there that may have a new pain that starts that doesn't go away, or a new open wound, or maybe an infection or chest pain and abdominal pain, and they're waiting to come in. Please contact your provider and make sure that you schedule a telehealth visit or get a question answered where you may need to come in and see the provider. Now, if you do come in for an office visit, please know that we're taking all precautions to keep you safe while you're here and getting your care. Also, if you feel you have coronavirus symptoms, please call our Christie Clinic Coronavirus Hotline at 366-4070 to be screened. Thank you very much and stay well.
Great. Thank you, Dr. Pierce, for that information. Dr. Davis, I'll turn to you now. Obviously, there are some medical issues that are very urgent and need urgent care. So what's your advice to people who are experiencing an emergency medical situation?
We want to reiterate that the emergency department and the hospitals are safe places for you to come if you need attention. So if you have symptoms that may be indicative of an emergency like a heart attack or a stroke, we absolutely want you to still call 911 and come to the hospital so we can assess you. So some other things that just to remember, if you're feeling short of breath, if you or a loved one is having a change in mental status, confusion, or difficult to arouse, those are typically indicative of an emergency condition and should be seen. If you're not sure if the symptoms you're having are warrant coming directly to the emergency department, then please call your provider and they will typically be able to give you some guidance. But just know that we're here. We have protocols in place to keep you safe as well as to keep us safe during this unusual time. But we still absolutely are here for emergencies that aren't related to this current outbreak.
All right, thank you, Dr. Davis, and thank you, Dr. Pierce, both of you for speaking with us today. Just a couple last notes as always. More information about local resources and the local response is always available at champaigncountycovid19.org. And anyone who's out there who might be experiencing some challenges right now, 211 is a really great resource. You just dial 211, you get hooked up with the trained specialist who can find you different local resources and information. So just dial 211 and we'll get you some help. And as always, thank you to everyone for staying safe and staying informed. Thank you very much.